Now, since the pandemic began, they're starting to really take care of more patients, and now they're doing so with less staff. News 18's Perry Apostolakos caught up with IU Health Arnett hospitals to see how the increased demand for beds is really impacting the emergency room. So Perry, are patients who come in to be seen for emergency situations only being seen in the ER?
No, Marley. As a matter of fact, they are not only being seen in the designated emergency room beds. The lobby, hallway, and ambulance garage at IU Health Arnett are all being used as makeshift emergency rooms. ER Medical Director Nick Sansone says it's not uncommon for 30 of the 35 ER beds to be filled with COVID patients. The capacity issue is causing extended waiting times for those who come into the ER with other injuries or ailments. These adaptations have added an additional 20 to 25 places where patients can be seen, but another problem is staffing. Sansone says there is currently a crisis in healthcare with a shortage of nurses, paramedics, and other providers, which only adds to the challenge of seeing more patients more often.
With a pandemic where the nurses are not immune to getting COVID like the rest of us, and then they're out on quarantine, and it just makes it even more difficult to staff not just this hospital, but other hospitals in the state.
Sansone says he encourages those eligible to receive the COVID-19 vaccine in order to stay out of the emergency room due to COVID complications. And coming up tomorrow on News 18 this morning, hear about how local ambulances and paramedics continue to be impacted by the pandemic. Reporting in studio this morning, Perry Apostolakos, News 18.